Hi, my name is Elizabeth Eiserman. Public health is a subject that I hold near and dear to my heart. As a public health major, I see and know the value of it, and I want it to be well represented. Public health has been a fascinating subject from antiquity to now. It still has so much room for growth and change, but has also exponentially improved from the beginning of time until now. It has always held a high value of importance in the eyes of communities. It is clear that people have always seen cleanliness and hygiene as an important aspect of their day-to-day lives. According to Philip Rhodes and John Bryant on the Britannic website, religion, law, and custom were inextricably interwoven. One way that we can see this is that people even made themselves clean to come before their gods, so it's clearly important to them. I've been lucky enough to have gotten many opportunities to travel. One thing that is prevalent among every Roman ruin is the communal baths and latrines. This shows emphasis of the importance of cleanliness and proper waste disposal. They could have just gone outside or in a river, but they didn't. Both were often placed in areas that were easily accessible by everyone in the community. Cleanliness was not limited to the rich and privileged, but was an equal right to everyone. Even during problems like leprosy, we know that in biblical times, people were put in quarantine or were placed outside of the community to prevent the prevention of the disease. Unfortunately, this also led to discrimination, slander, and loss of dignity. Fast forwarding to today, public health is still of instrumental importance and is seen in health research programs, education, and promotion. The growth of doctors, nurses, educators, and more have been constant for hundreds of years. It has taken lots of trial and error to figure out what the best cure and prevention options are for various diseases. An example of this is using leeches to suck out blood. In medieval times, royalty thought that if they wore the same undergarments without ever taking them off, that they would never need to bathe. This, of course, is wrong, but they've had to figure it out somehow. All the failed attempts have ultimately led to where we are today, with an ever-growing field of research towards better general health of a population. The biggest feat of public health globally was the eradication of smallpox. According to the CDC, the virus first sprung in the 3rd century, but it took until the 18th century for smallpox to be transmitted to all majorly populated continents. In 1789, vaccinations began to be used in England. An intensified eradication program by the World Health Organization was implemented in 1967, and the world has been officially smallpox-free since 1980. But what about America more specifically? One of the most impactful public health feats in the United States has been the elimination of polio. This infectious disease often led those affected to a crippled life and even death. Through the dedication of healthcare professionals all over America, almost everyone had the opportunity to take the right vaccination precautions. These said precautions are still vital because polio has not yet been globally eradicated. According to the CDC, the United States has been polio-free since 1979. To show the progress of public health in America, here is a graph representing the crude death rate per 100,000 people for infectious diseases in the 1900s. Environmental factors have played a huge role in the development of public health, mainly because of the problems they cause. According to the environmental health page on the Healthy People 2020, 23% of all deaths and 26% of deaths among children are due to preventable environmental factors. Some of these include exposure to hazardous substances in the air, water, soil and food, natural and technological disasters, climate change, occupational hazards, and the built environment. Some emerging issues from poor environmental health are climate change, disaster preparedness, exposure to unknown hazards, and so much more. The world has been taking leaps in addressing these issues. One example is that of how California, along with many other states, has placed a price on single-use plastic bags to reduce plastic pollution. As mentioned earlier, vaccines have helped both the United States and the world in the decrease and even eradication of illnesses. Vaccines are a fairly inexpensive and usually highly effective precaution to take to avoid a wide range of illnesses and diseases such as measles, rotavirus, smallpox, chickenpox, yellow fever, shingles, the flu, and more. Some of these can lead to severe and contagious sicknesses, even causing death. One way that the public health system has done a great job in the field of vaccinations is by enforcing laws requiring school-age children to be vaccinated. According to the CDC in their state vaccination requirements page, although many vaccinations are required by state law, it is not too difficult to be exempt from them. They suggest that there should be more rigor in exemption requests and more education for hesitant parents. It explains that exemptions tend to be found in specific communities, which allows for more outbreaks within those communities. Besides that, though, children have seen exponential growth in use of vaccines over the past 40 years, as you can see in this graph, which is the share of vaccinated 1-year-olds globally. You can see the exponential increase. It's really crazy. Within the public health system, there are multiple facets through which people work. Regulations are made and change happens. The public, private, and voluntary entities are all different and play different parts in the world of public health and ultimately in the help that they receive. According to healthcare and public health sector, and as mentioned in my third supportive submission, the public entity is that which covers the most ground within the government. It touches on the national, state, regional, local, tribal, and territorial levels. Because it is directly tied to the government, it affects schools, various agencies, Medicaid, and more. It plays the biggest role in the response to both man-made and natural disasters. It must depend on other sectors to operate in full and strong capacity. The American public health system has put in place a set of services that must be undertook by all communities in the nation. They are goals for a healthy system that will lead to healthy lives. They are called the 10 essential public health services. They include activities such as monitoring, diagnosing and investigating, informing and educating, and mobilizing communities to solve health problems and find better options for treatment and prevention. The private domain is smaller, but might have an impact of higher quality than that of the public sector. Funds come from a variety of different donors as opposed to the one main one. A way of raising money and support is through the donations of individuals. In foreign countries, privately owned clinics tend to be better and are more efficient and accountable and sustainable. Another non-governmental entity is voluntary. These are the charities and ones that some could argue are those mostly based on the simple goal to help people. They are also privately funded. Public health contains a whole world of concentration. At CBU alone, public health majors can have concentrations in health, education and promotion, healthcare administration, environmental health, and global health. The first three tie directly into the role that public health has in healthcare access, delivery, and law in the United States. Health education and promotion aids in raising awareness and the importance of healthy lifestyles. This then leads to encouraging people to access the health departments that they do have for vaccinations, checkups, fitness, nutrition, and so much more. Healthcare administrators help facilitate the delivery of a good healthcare system. They advocate for both sides, that of the patient and that of the provider. They want to ensure the best care for those in need while being certain of protecting those that sacrifice their strength and energy for those people. Laws are implemented by those that really care most about the needs of the nation. They are to overrule personal decisions that people make based on their own ethical beliefs. They are created by public health professionals with the hopes that ultimately beneficence will ensue. I really appreciated this course, especially as a public health major, as we dove into what public health is really about, who it includes, and what my role will hopefully be. We went through the book learning about population health, the health system law, government, community health, emergency preparedness, the workforce, administration, occupational health, nursing, epidemiology and disease control, education and information, and more. The public health system could really go in a lot of different directions. Through the changes of presidencies and leading political parties, it seems that some values and interests have changed. By many, this is seen as a disaster, but until law is set in stone, I do not want to predict or hope for that to be true. In contrast, with the hard work of dozens to hundreds of public health professionals, policy writers, and strong advocates, maybe the United States will be able to go down a good path that will provide a solid and sustainable system that will be able to help people of all areas, ethnicities, statuses, and incomes.